I didn't wash it this morning.
Yeah, and I just finished getting a whole lot of
Let me.
Facebook. Everyone can see and hear me. Good to know. Don't curse. Okay.
Well, even if you curse, it's okay. You know, the FCC is not gonna kick us out.
Yes. Okay.
Yeah, so we'll be good. Hold on, I'm putting it on my page.
I wonder what it would look like.
Share.
This way. This way. You are so technologically advanced.
Not really, because I'm sitting here on live and not talking because I'm trying to post something.
But at least you know how to do that. That's what I'm saying. Yeah, now I can see. Alrighty then.
Okay, so I can't remember if we did it before, Shawn. Yes, we did. You've done it before. We got to play my game. You know, I love my game.
Oh, right. And all by myself. Remember, yes, I did do this before.
Okay, hold on. Dr. Garrison.
You know, I'm going to lose the game, right?
Why does everybody say that?
I don't have a black people card, but okay, I'll do what I can.
I think Alethea said hi. I see somebody that's posting as African American mental health, so it must be Alethea. She said hi.
Oh, okay. Hi, because I don't see any postings.
Oh yeah, you don't. For whatever reason, it doesn't let you guys see the comments. I don't know what that's about.
But then you'll have to read them, you know, if they're relevant, because I can't.
Yeah, I will. I'll put them up too. I can put them up so you can see them. Let me get my timer. Okay. Dr. Garrison, it's easy. So let me just remind you of the rules. Black love, right? I'm going to give you a category. I need you to name 5 things in that category. And you're going to do 5 things in that category. I decided today I'm going to just give them a little more time. I'm going to give you 15 seconds instead of 10. So 5 things in 15 seconds.
Okay.
In that category, you cannot say any filler words. So no don't say so like I just said. No so, us, ahs. Just say the things in the category. Represent for sisters. Out the dirty South. Represent. Okay?
Just don't ask me the name of any TV shows or movies. We good. Okay.
Okay. My first category for you, Dr. Garrison, I need you to name 5 feeling words, but you cannot name sad, happy, or angry. 5 feeling words. Go.
Lit. Mad. Pissed.
You said
Okay, in your feelings. That's 5, right?
You said
So does that disqualify me?
Yes, it disqualifies you on that count. On that try. I got never fear. As any good Black woman, I always have a backup. So let's try it again.
I'm ready.
You got to represent for the ATL. Okay.
I'll do my best.
You one of the few people that can say I'm from here. I didn't come here. Okay.
Grady baby.
Dr. Garrison.
Mm-hmm.
Your next category is Black women in history. 5 Black women in history. Go.
Harriet Tubman, Kamala Harris, Michelle Obama.
They go
I was doing so well. I was on to the Nikki Giovanni.
You were doing it.
Nikki Giovanni and Maya Angelou.
You had your little rhythm going because you were like holding it. You were holding it.
That's what I do to think. Okay, why I can't say I mean, why I can't say
Okay, one more time. This is the bonus round. This is the last one. Bonus round. You got this category. Remember, 5 things, 15 seconds. No ahs, so's, no filler words. 5 things that a Black psychologist will say to you. 5 things a Black psychologist will say to you. Go.
How are you feeling about racism these days? How is that working out for you? What did your family tell you about this?
Time.
Ah,
Really good.
I was trying to.
That was good.
I didn't say
You did not say that was good. I would have added there, don't try me.
I was trying to figure out a way to say that, without like, okay, so the other word would have been really? Really?
And you kind of said it. I have my version of how's that working out for you?
Yeah. So did that work out for you? I'll tell you the other thing that I do often say is, especially to the patients I work with at Grady who have to talk with their physicians, and Grady is an octopus. I will say, especially with the women, you're a grown woman. You have solved many problems. You walk up in there with that doctor, understanding that you're as grown as they are, and that you have to ask your questions. If you don't understand what the doctor said, they haven't answered you yet. And you know how to ask another question.
Wow. One of my favorites is, but you can only do this with your long-term clients when you got good rapport and they say something crazy. You're like, get out of my office. Go. Get out of my office.
Okay, so with my students, what I will say is, I'm gonna throw this pillow at you. Say that one more time. And with my well-established people, especially if we are having sort of a CBT approach, and I ask a question in terms of, well, what were you thinking then, or how were you feeling? And they go, I don't know. I'm gonna say, you can't say I don't know. If you don't know, I certainly don't know. What are we doing? So let's roll that back. You can say to me, I haven't figured it out yet. You can say to me, I'm trying to connect with that, but don't say I don't know, because then we won't have anything to do. We won't have anything to do.
Yeah. The thing is, wait a minute. My all-time favorite is, I will tell people, okay, I'm taking my therapist hat off. I'm going to put my sister hat on right now. Mm-hmm. So the conversation is different if I have to put my sister hat on.
How do I do that? I sometimes just say something that signifies I'm about to take a half a step to the left. And I will say, so for real, with some men and women, actually. I'm okay, so really, let me just back this up and tell you what is actually true. When I say that, we're about to go in. We're about to go in.
Well, there it is.
Well, there it is.
Good afternoon, everyone. If you are just joining us, my guest today is Dr. Shawn Garrison. She is the director of the Center. You got
services.
Director of Counseling Services at Morehouse
School of Medicine.
I have known Dr. Garrison for a long time, so I actually know that it's called Morehouse School of Medicine. I just couldn't get that out right there. And she's a psychologist. She is an amazing woman that has a long history of training medical doctors at an HBCU, psychiatrists specifically, and has been in this field on the ground doing this work for a really long time. So thank you, Dr. Garrison, for coming and having this conversation with me.
Thank you for inviting me. This is really an honor. And I was busting my to make sure I got here.
Thank you for that. And thank you for sharing your birthday.
My baby girl's birthday, yes.
It's your birthday, though. You birthed.
It was the day I gave birth, absolutely, 30 years ago. Oh, man, I missed it at 11:12. That's what time she was born.
Wow. Wow.
Yes. Well, we were getting reflexology at the time, so it still counts.
There you go. I want to jump in, and we're going to have this conversation today about just the therapy process. How do you find a therapist, choose a therapist, and how do you know the therapy is working? Let's start with something that's really basic that people get confused on, and I figure we could just do this together, is around licenses. Let's talk to me about the different types of therapists there are. Like, we have psychiatrists, psychologists, all that stuff.
So the first thing, again, I'll reference, I'm director of counseling services at Morehouse School of Medicine, but I also have 2 half-day clinics. One is in the Georgia Cancer Center, which is set in Grady, and is actually the oversight is Dr. Roland Matthews, who's MSM physician. And then I have a half-day clinic at Morehouse Healthcare, which is the private practice arm of the medical school and sees people in general Metro Atlanta area. So again, with my Grady patients, because everybody is used to talking to a MD, the first thing I say is, hello, I'm Dr. Shawn Garrison. I have a PhD, not an MD. So I am not a medical doctor and I do not prescribe medications. I'm the talk therapy doctor. Is that what you were looking for? So we have to go through that first. So the first thing is to know that under the umbrella of mental health, you can see a psychiatrist who is an MD. That means they have gone to medical school for 4 years or more. Then they have a 3 or 4 year residency in psychiatry that is primarily designed to teach them what psychotropic medications work with which particular diagnoses, a big emphasis on diagnoses, and then a minimal emphasis on therapy, as it has been in recent years. That's not how psychiatrists used to be trained. There was more emphasis on therapy, but not so much now. And so then outside of the MD, you have PhDs and master's level therapists. PhD psychologists can also be PsyD, which I think the PhD involves the dissertation, and the PsyD is without the dissertation, the research aspect of it. You can have clinical psychologists, counseling psychologists, as I understand it. And then you can have master's level folk, licensed clinical social workers, licensed professional counselors. I'm not sure what the other
licensed mental health counselors,
and that's the new one, licensed mental health counselors. So
and marriage and family therapists, we got to include those.
Oh yes, because that's a really important way to look at people and communities and families. You're looking for persons who have a clinical bent to it, because some social workers are not trained to do individual clinical work, but community social work. So you want to be careful about that. So that would be licensed clinical social worker. Then you have, there are different requirements for different licensure across the different types of degreed professionals. But everybody has a process that now involves, I think, supervised therapy hours, and then you get a license, and then you have to have some supervised therapy hours. You can also be a LA licensed associate
professional counselor. So they have, that's for social work. They have a LMSW. APC is a licensed associate professional counselor. I don't know what that is for marriage and family therapy,
right.
But those are associate license. So that person has gotten a master's degree, but they don't have a full license. So that person can't work independently. They must work under someone, under supervision.
And mostly that's on the way to your full licensure. You have to have your hours, your supervised hours. So that's what that is. So it sounds like a crowded highway, and it is sort of. Mm-hmm. So for right now, I want us to take away that you're looking for someone who has a clinical bent to things, mm-hmm. and also is licensed, which means that they have some specific requirements they need to live up to. It means that they've had some supervision hours and that they are held to a particular level of integrity and standards.
Okay. And also another one that we didn't include is school counselors and school psychologists. So there are so many people.
Right.
It's a crowded field.
Right. What people also need to understand is psychologists can do assessments. And then there's a person called a psychometrist who is really supposed to administer the assessments and score them, but maybe not necessarily write up the reports and give them out. So there are different levels. The school folk are more certainly involved with a narrower lane, and mm-hmm. they do some testing. Right? No, they do testing.
Yeah. They get trained, school psychologists get trained to do therapy and assessment, but mostly their interventions are going to be, I mean, all their interventions are going to be in a school setting, and they'll mostly the therapy would be in a group setting. That's what they get trained to do. However, when they get in schools, then they are mostly doing assessment. School counselors also get trained to do therapy. However, when they get in schools, they're mostly functioning from a guidance perspective. So
Right.
getting students graduated,
Right.
dealing with kind of like the everyday academic portions as
Right.
opposed to the therapeutic portions.
So what people need to know, especially about this whole assessment thing, is that you have to have some specialized training to be able to do certain assessments. You have to have a certain level of degree and certification. And it's not just anybody can go out and buy some tests and just give it to people.
No,
So
man.
I do need people to understand that because you need to be asking questions and looking for, what are you, licensed to do? How often have you done this? That kind of thing. So do know that any mental health professional that's coming to you should be doing what it is that's in their lane to do according to their license and then according to their training. Because some people's licenses give them permission to do some things that's not actually in their lane because of their own level of experience.
Well, okay, so we need to add that to the list of things that Black therapists will say to you is stay in your lane. So
What's your lane? Let's stay there.
that is very important. So if you're looking for a therapist, I think the first thing you need to do is understand what is it that you need. So if you need medication, you go to a psychiatrist. That's a medical doctor. Their specialty is psychiatry. These are the only folks that are going to give you medication.
Right.
Well, your primary care, but that's a whole different thing. So if we're thinking about mental health, it's going to be it's going to be the psychiatrist. If you need psychological assessment, so you think you have ADHD and you want testing for ADHD as an adult, or you want your child to have ADHD testing, if you're not doing it within the school system, if you're doing it on the private end, you're going to go to a psychologist for that. If you are depressed and you want to be able to talk to someone, you can go to any of those folks that we just talked about. The psychiatrist intervention is primarily going to be medication.
Right.
The psychologist is going to be testing. They may refer you for medication. The counselor, a licensed clinical social worker, marriage and family therapy therapist, they are also going to talk to you. They may also refer you for medication, but those are different levels of training.
And we haven't talked about, again, like the marriage and family therapist. I think that that's a really important thing to pay attention to, because especially as we're learning now with COVID, with quarantines, that community is really important, and your family is one of your first communities. So generally speaking, family and marriage therapists look at you as an individual as a part of a system, which is a very healthy and powerful way to approach things. I also want to say that who you see initially does sort of suggest how the problem will be defined. If you go to MD first, the problem will be defined by your symptoms and what medicine they have to address those symptoms. Primary care physicians often prescribe psychotropic medications when they shouldn't, but sometimes when they should. And I also want to say that it's very difficult to get into see a psychiatrist or mental health professional right now. Everybody is really, really booked. If your primary care physician says, I really want to help you with something, and let's try this. If you have a good relationship with that person, by all means, try it, but don't think that that's the end of it. That's a stopgap for getting you to a more full assessment of whatever's going on. I think many psychiatrists, I don't know. I don't think there's a lot of psychiatrists really that will say, hey, you're depressed. Here's the antidepressant. And by the way, go get psychotherapy. That's not generally the way it goes. So you want to pay attention to that. And I want to talk a little bit about the testing too. ADHD is a big thing, and it's a real thing. And my end of things, where I'm dealing with adults, medical students, residents, people who are having difficulty focusing, and also people who are trying to get an edge over someone else. So I am concerned about how quickly we might want to identify somebody as ADHD. So for me, with the population I deal with, I mean, the medications for ADHD are very helpful, and we have a couple of them that work well, but generally speaking, they're stimulants in some form or fashion. So anybody does well on a stimulant. So
Because you're gonna be high.
we'll be zipping along. If your brain is not wired in a certain kind of way. So for my folk, I say I'm gonna need you to go get a neuropsychological, which is um, a full test battery that looks at how your brain is working, how your cognitions go. So it's looking at more than one thing. And I know too that if you walk into some psychometrists and say, I want to know if I have ADHD, well, a lot of times you find what you're looking for. So I think that too, you should advocate for yourself and be clear and just say, I want to know everything. It isn't that ADHD isn't there, but we call them comorbidities. There's more than one thing going on. Human beings are multi-layered beings.
Mhm.
And so there's always more than one thing happening. So I think if you're going to go ask for some help and get some information, you should get as clear of a picture of the lay of the land as you can afford.
Wow. Okay, now you introduce other folks. We didn't say anything about the neuropsychologist. So that's a whole other category. Okay, so let's try to do this, because once we start talking about it, we realize that we take this stuff for granted because
Yeah.
we understand the nuances and it's so layered. So if we could, can we let's kind of group
Okay.
some presenting problems. So there may be things that people present with, like if they're seeing and hearing stuff that's not really there, or they have intense highs and begin to do stuff that is completely inappropriate because they're having those intense highs, and then they think that they are hearing messages from God. So when people have those types of symptoms, those are kind of in your category of chronic pervasive mental illness.
Mm-hmm.
That's one category. Then you have things that are your depression, your everyday anxiety. You may have PTSD, which is still can be a chronic condition. That's another category of issues. Then you have things that may be kind of early developmental issues in childhood. We're going to see ADHD in childhood, maybe autism, and maybe a learning difference. Those are things that show up in early childhood. And then on the kind of geriatric end, we may see dementia or other kinds of cognitive issues.
Right. You have the organic things too, like the dementia, but also if you've had car accidents, you have closed head injuries, you got, brain injury that's sort of low grade, and you wonder what's happening. That's a different category as well.
So then with those kind of categories, if we kind of just bunch those, and that's an imperfect bunching, and it's not like you're going to read that in a textbook or anything. I'm bunching that in my head. Okay. So if we have those and people are thinking that they have some symptoms, how do they figure out which one of those types of therapists that they go to?
So interesting enough, for me, when I think about the continuum of issues, I think about how disrupted your life is.
Ooh.
So how disruptive is this symptom? So for example, we also want to put things in categories of thought disorders and affective disorders of the, emotions kind of thing. And thought disorders is what you said, where you're having difficulty actually, where your reality testing is either broken or severely compromised, and you can't really tell what's actually happening objectively or not.
What is reality?
Right. When you can tell what's something happening objectively or not. Objectively meaning outside of your head, and that other people can also verify that this is actually occurring.
Mm-hmm. Okay.
So for the more severe end of what can go on with the person's mental functioning, you might want to start with a psychiatrist first. A psychiatrist or a psychologist. A psychologist can say, here's the whole picture of everything, but this part right here is definitely going to need some consult with an MD, with a psychiatrist, because this is the West. We have medicines that I'm hesitating. Like sometimes, like you need a needle and we got a hammer. So, but they do some things that are really necessary. So some stuff isn't going to get touched by talk therapy quick enough for that person's safety or their life. So the more a safety issue is involved and you're pretty clear it's a mental health issue, it would be a psychiatrist, sometimes you'll get sent to a neurologist because a person maybe have had a car accident. Now they're seeing things we don't really know, but that kind of thing. Then as you move to, and there was other confusing, just make sure that we stay confused. Sometimes people can have affective things of the emotions, this swing, high, really manic, and then really depressing, and that's mostly your emotional landscape. But sometimes your reality testing can also get compromised. And that's when you have mostly a feelings kind of problem, but a thought disorder is involved in that. So that end of the continuum can be psychiatrist or psychologist. Again, I will say if someone is really disrupted in their ability to function internally or externally, or they're dangerous, then you probably want to go to the psychiatrist first, because if you go to the psychologist, who you'll need to deal with eventually, but it's going to take time then to get to see this other MD who may be able to help this person stay out of the hospital and do whatever. Then a wide range of issues. It may be me because I have a bias as a psychologist. I also think sometimes we act as almost case managers. Like, okay, let's talk about this. What's all the things that's going on here? And then we can help you figure out what part we can do, what part might be some other things. So relationship distress, job issues, depression, moderate to almost severe to mild, family disruptions, that's a family therapist thing. But I also
I think we can do it too. But anyway, go ahead.
right, we can. We really can, although some of us are better at it than others. So what I'm saying is that you can end up with in a couple of different places with these professionals, and you may be okay and you may not be okay. So at this point, our, what do we call it? Licensed mental health clinicians, masters of mental health clinician. What is that?
Oh, licensed mental health counselors and licensed professional counselors.
Right.
LPTs and LMH.
Right. They have a broad range of issues that they also deal with, as well as psychologists, as well as family practice doctors, family marriage and family therapists. So this kind of moves me into something else, which is if you get in with a therapist and you feel like maybe this is not happening the way you need for it to happen, and you don't feel like things are going in the direction you need to go in, it may not necessarily be because that person is poorly trained. It just may be that person's in their lane and you might need something else. In addition to, y'all might not be really jiving. But so with the more severe disruptive issues that can come up, psychologists and psychiatrists, and then psychologists and our other mental health professional brothers and sisters can also handle. Then the long list of other things that can happen with human beings.
Yeah, I like that way that you described that. I think that was really, like, it gave clarity for me. Okay, I'm like, okay, that makes sense. Yeah,
Right,
and
because I know when I'm talking with somebody, yeah, I have a when I know I have somebody's got delusions, maybe not, when somebody's got hallucinations, or I'm really concerned that their reality testing is broken, I need to see how far medicine can go in terms of stabilizing them before we, with the other things that we do. And so that would be the first thing I kind of move it in that direction, if that is appropriate from my perspective.
and let's just talk just for a second about medicine, because folks in general tend to be really hesitant about medication, and within our community, because medication and psychiatry has not been kind to us historically. And so from your perspective, having done this as a seasoned psychologist, what would you say to people that were hesitant, that had a thought disorder and they needed medication but were hesitant to take it?
Well, first we need to remember that my frame here is for the past 31 years. I've been at Morehouse School of Medicine in an HBCU environment, and I pretty much only talk with psychiatrists of color, or certainly psychiatrists who have been trained and inundated by people of color. So, that's such a difficult question. The question is not, should someone take medication if they have a psychosis or a thought disorder? The question is, can you trust the person who has diagnosed you with a thought disorder or some reality testing problems? Because that's where the problem comes in. So I want to say to people, if this is a professional that you have reason to trust, and they say this is something that would be helpful, then I think you need to try it. The issue is if you're walking in off the street cold with speaking with a psychiatrist and you feel they're not listening to you or they're not taking into account your family environment, your social environment, your history, then I would say, be careful about that. I also would say if life has gotten difficult and complicated and disruptive enough to walk into somebody's office that would make you uncomfortable anyway, then something big is going on. And you need to weigh the consequences of keep being disrupted versus taking a chance and see if something works. I notice with a lot of people and my patients that when we go to a physician or we're talking about taking medication of any kind, we feel like it's a decree. And so sometimes I have to actually say to people, like, nobody's going to put you in jail if you decide not to take this medicine. I'm just saying, try it, and that you can try. And if you don't like it, you don't have to. It's not like you have now been labeled. You do have a label, I think, with the insurance companies, but you don't have to keep doing something that is uncomfortable for you or for your family. There is something about trusting the person who explains the medication to you, because trying medication requires a certain trial period. You can't take it for 2 days and go, oh, it didn't work. Or you can't take an antidepressant like an aspirin. It's not going to work that way. So we have good reason to be distrustful, but maybe not so much of the medicine, but of the person who is deeming you need this medicine.
I love that. I love the way that you said that. And one of the things that I realize as I talk to folks is that there's so much misinformation about psychotropic medication. Because, like, I'll have someone that has been prescribed an antidepressant and they're like, well, I don't want to take it because I don't want to get addicted. And I was like, you can't get addicted to an antidepressant. You can get addicted to an anxiolytic, which is some medication that sometimes people are given when they have anxiety. And there's certain ones that are problematic. But people have like so many misinterpretations of medication. And then sometimes people aren't actually even empowered to ask their physician or their medical provider around.
Absolutely. That's one of the things that having a therapist and a psychiatrist would be helpful with. So, because as would make sense, people would have issues, concerns, fears around the medicine they have to take, which would be an issue for therapy. And being able to speak up with your physician, if that's what you have, is also a learning process. That's a behavior change. That's a therapy issue as well. So you need both of those. I think I talked with you maybe yesterday about how with the patients at Grady, I do have to say to them, look, these are people who are dealing with cancer. And of course, come to me because, oh, I'm anxious. Oh, I'm depressed. And I'm like, you should be. This is a big thing. Yeah. So don't let any physician put my schedule thinking somehow we're supposed to fix it. So now all of a sudden you're not anxious. That's actually crazy. So the first thing is, do you understand what's going on with you? And I make sure that my patients in our theoretical therapy sessions, look, this is how you talk to your doctor. And this is what you're supposed to get from your doctor. So I have many women, especially, I don't know, I'm anxious, I can't sleep. Of course, that would make sense. You don't understand what's going on in your body, but you do understand that this is huge and life-threatening. Any normal, sane person would be upset about that. So first, let's get information so that you decide what your questions are. And then let's make sure we can have you ask those questions and get answers. And then we'll see how anxious you are, because there will be other stuff, but this is not something to talk away. And that the doctors are there because they went to school a long time because they wanted to serve you. That's why they're there. So you show up like the queen you are and be served.
I heard that. one of the things that I also remind my patients to ask doctors about if they say, well, I want to do something more natural. So if they're depressed, I'm like, oftentimes doctors actually know the medical literature on that. And so for something like depression, there is great medical literature on things that are more natural that you can
Yep.
take. And if you ask the physician, they can say yes. Oftentimes they're not prescribing that because, like something like SAMe.
Okay.
SAMe, great evidence that just supports that it does work. You got to take it for 2 months straight. And most people are not going to do that. They want a quick, because we live in a society
And
where
see, that is so interesting because on the one hand, especially our people, okay, I don't want to put it in my body. I'm, but then at the same time, they want something fast. And, Western medicine is fast. Like I said, still we've come a really long way, but still sometimes you might need a needle, and this pill is a hammer. It's gonna handle what it needs to handle. There may be some other things going on, but you said you wanted something quick, or maybe you have let it go on so long that you need to do something quick. But even for us, especially we're talking about antidepressants, quick is still 6 weeks. Quick, it doesn't happen much quicker than that. And anti-anxiety medications are a whole nother thing. But I think it is important, like you say, to go to any mental health professional that you are and saying, I want to try this natural thing here. But since this is your mental health team, you have to be on the team, and you need to bring your information to the doctor if they don't know about it. If they don't know about it, you don't need to go, well, I have to talk to you. Maybe they don't know about it. Maybe they're overworked too. Maybe it's an interest that have. Bring it to them and say, what do you think? Let's make this decision together.
And I even think about this, and we're going to move on in a second. So I know Morehouse has the whole clinic, and this is for kind of lifestyle when people have chronic health conditions. And Morehouse has this whole thing where they're looking at like vegan lifestyles and healthy eating and things like that to manage chronic health conditions.
It's a plant-based, what do we call it? It's a they call it lifestyle, plant-based lifestyle or something. Dr. Jennifer Rook is just the most adorable warrior person ever. What I love about her is that she is going to educate. She's going to teach you why this is so important to her. They have something called shared medical appointments, or at least they did when we could be all in the same room together. So she is shepherding and guiding people through the process of getting on a plant-based diet. And she's pretty much a boot camper. Like, I can't do that. You can't have oils. You can't have this, that, or other. And it sounds horrible, but it's not. And we have people who are on, 12, 15 medications, and they want to get off these medications. So that is but it's a lifestyle clinic. We didn't say diet, lifestyle. And there's a lot of education that's involved in that. We also have some alternative stuff going on over there. And then we have the community health and preventive medicine arena, and we have a public health arena. So we do have other areas that are beginning also to say, fast might not be the best thing. And that if you want to make changes, then it takes time. I tell my patients, look, I'm really good. Like, I'm great. However, I don't have a crystal ball or magic wand. So if you happen to be, I don't know, 25, 32, 48 years old, and this discomfort that you have now in your life that is bringing you to therapy has been building up across many years of your life, we're not going to fix it in 2 weeks. I don't think you should expect, because if it gets fixed in 2 weeks, it's not fixed. You certainly can have symptom relief, and you can certainly learn something different, but it's about the process that you engage in with yourself in your life.
I love it. Okay, so we've gotten through the licenses, and you go and you pick this amazing psychologist, Dr. Love. There we go, Dr. Love. What do we ask Dr. Love when we get her on the phone, hopefully, and trying to determine, is that the therapist for me?
Okay, so now in 2021, before you talk to Dr. Love, you might go ahead on and Google Dr. Love. And make sure that you don't see anything just in public domain that gives you reason for concern. Or if you do, that's one of the questions you ask in your first conversation. So Dr. Love, What kind of patients or clients do you normally see?
Hmm.
What is your training?
Yes.
What is your general approach to therapy? You know, how does this work? And really, when I see new clients, people rarely ask me these questions. Like, I have to like stop them. Like, oh, let me tell you who I am. Just so you know, it's just so you can have some understanding about this. So it's very empowering. First thing you should do is say, first of all, I Googled you. So this thing right here, what was this? It might have been 1999, but seriously. Then what is your training? What kind of issues or problems do you normally work with? Um, how do you approach this? And
Mhm.
if you have a specific thing going on that you think might be a little bit different, you can say, this is, as you talk about whatever it is that you have to do at the end of your first encounter with this person, that they've maybe gotten a little bit of information, you all have kind of decided what you might do and might not do. It is perfectly acceptable to say to the person, so how many times have you worked with this kind of thing? Like I think you should say that. Um,
Well, and can I add put an addendum on that
uh-huh.
with my population? So
Yes,
not
that was
just
the next thing. And
okay.
with Black people or white or Black women or Haitian women who've been in the United States since they were 3, or because we have, a multi-layered what's the intersectionality of all kinds of things. So whatever it is that is concerning to you in your head, just say it out loud. And
Yeah.
how much have you worked with people who are like me? And I mean, is this, and this? You good with this? Like for me, I would have to say, so do you know about, colorism in the African American community? So when I say,
Mhm.
somebody's upset me about light skin, do you know what that means? And
Mhm.
in all honesty, are you open to learning about what that means?
So that's so interesting. Okay, so I had this experience when I was in my doctoral program. My supervisor was biracial, and for whatever reason, they thought it would be a good idea to put me, the super blackity black girl, with someone that was struggling with their identity. Um, Needless to say, that year was very painful, and it did not go well.
Right, because that decision wasn't made in your behalf, but that decision was made on behalf of the faculty that they felt more comfortable with. You were supposed to fix that person. That's horrible.
So here's the interesting thing that goes to that. So obviously, I'm not a light skinned person, but when I said to him, I said, so my grandmothers are biracial. He was like, what? And he was so shocked, and he had like all these questions, like this revelation, like we had these connections around that. And I said, most people look at me, and particularly when they look at my hair,
They
they
assume
know
that.
something else is going on with
Uh-huh.
me. And I thought that was really interesting because it goes to that point. Like, and so this wasn't a therapy relationship, it was a supervisory relationship. But he didn't have enough awareness to be able to look at me as a Black woman. I just got put in one category, as opposed to recognizing there may be these other layers that are impacting her. So yes, understanding colorism within the Black community, understanding hair politics within the Black
Yes.
community is significant. Wow. Okay.
Hmm.
What else should we be asking?
Yes, or being able to, because um, should also I did go and do a little bit of research on this, because I do have to obsess a little bit, and something came up that was interesting for me that I didn't think about,
Mhm.
which is, and what are your protocols for emergency situations? Like,
Mm.
what if something huge is coming up and I feel like I'm in an emergency, or I tell you about somebody else is in an emergency? Like, I don't want to find that out at the last minute. Are you prepared for psychological emergencies? That's a good
Mhm.
question.
Because some people aren't. Well, and a lot of people, like in our forums, we tell people we don't do psychological emergencies. So if that's what you're
And that's
needing,
something you need to know. If your therapist should tell you what are
Mhm.
the limitations and parameters of things. And
Mhm.
I often, again, now in the virtual world, some of the clinics I have are audio only, which means telephone.
Okay.
And y'all, I'm old, all the other, I couldn't get there. Wish I could call for my cell phone. Like I cannot, all this extra stuff. So just call for my cell phone. I don't save anybody's numbers, but they have my number, of course, because I text them, say, you ready for a phone call? So I've had people call or text after they're not available at the session time. And then they go, hey, I'm here now. Like, okay, well, I'm not. Or people will call and say, I just really, they have my number. This is really awful. Is there anything you can do for me? And I do have to say, our therapy sessions happen in the time frame that we agreed to, and they don't happen outside of the time frame. So I may respond and say, I'm sorry, the session time is over with, or I really do wish I could help you, but I cannot see people outside of the clinic time and outside of our scheduled time, because there's a fee issue. There's the whole, get it paid for thing. So your therapist should tell you what the limitations are. And that should be a part of the conversation of how do I do therapy and what is my approach. But if you don't hear about how available are you to me, because that's what we're asking, how available are you to me? Do we have interaction in between sessions? How do I pay you? To whom do I pay? You need to clearly understand if they have not explained it to you. You have insurance. What part does insurance do? What part do you do? Clearly understand that. Therapists are supposed to give you some information in written form, and it's pages and pages, and sometimes people don't read it all. So you want to actually, so really as the client, you want to think about what could jump up and bite me in the butt that could make this very difficult for me. And as therapists, what we know is a client needs to understand what the definition is of an emergency. What are the rules for interacting outside of the scheduled therapy time? And what are the rules about payment and non-payment?
What about racism, white supremacy, privilege? How do you ask those kinds of questions?
I don't know. I don't really talk to. Whether your therapist is of color or not, I think certainly at this point you need to say, how do you accommodate or fold into the interactions with the clients that you have, the understanding of racism in America, or how we all have been impacted with the recent events. But more importantly, do you understand, or how do you understand the historical ramifications of racism in this country, and how do you make room for that, and how you approach therapy? That would be a question that I would want people to ask. Honestly, though, when I was thinking about this conversation, really what I know to be true is almost anything can be worked out if the relationship is a trusting one. Certainly people of color, but human beings in general, we are a high context people. That is, we do everything within the context of a relationship. You meet somebody, you can be in Boston or other side of the world, and who are you people? Where are you from? I'm trying to understand, what do we have in common? What kind of relationship can we build? What do I know about you that sets a pipeline? And once that relationship is built, that understanding, the expectation, lots of stuff can go through that pipeline, and that there can be bumpy roads, but the relationship holds. So, and we know this with, training physicians. Physicians don't get sued that much when they actually have a rapport and a real relationship with their patients. It isn't that they don't make mistakes. It is that there's a relationship there that helps understand what happened and to have resolution. So really, I would say, if you feel like you can actually establish a relationship with this person, and people are individual, me, it's the energy. Does this feel like you're going to be able to live here for a while? And does it feel like a safe space? If it feels like a safe space, then you can bring in your whole self. And that is the determination of a safe space. You can bring in your whole self. You can bring in your questions. So you ask your questions at the beginning, the things that we've suggested. But that doesn't mean that you turn your brain off after the first 2 sessions, because something may come up later on and you may go, this is uncomfortable for me. You should be able to talk with your therapist about it. And if you can't have resolution, you're not supposed to stay there. Like, again, nobody's going to put you in jail if you decide not to go see this therapist that you've seen for 4 times already.
So it's really interesting because I think the way you describe that is really good. So whatever the issue is, if it's a gender issue, it's around your sexual identity, it's around race and racism and privilege and white supremacy. If you don't feel comfortable bringing those things up with a therapist, and that's not a good relationship to be in,
That's not a
regardless
safe
of the
space.
person.
Right.
And don't make the assumption just because the person looks like you that they'll be able to understand those issues.
That's what I was about. Well, I was about to say two things. The first thing is, if you are uncomfortable bringing something up, it may be because you're simply uncomfortable in yourself and you've got to learn how to actually say what you need to say.
Mm-hmm.
But it also could be you're getting some sense that this is not an okay thing to say. And really, again, just like I say, with my patients at Grady, this is a two-way street. That other professional is not supposed to be reading your mind. That other professional isn't actually supposed to be completely and totally perfectly designed for you. You have to also say, "Oh, this is uncomfortable, but I need to ask this of you." Like, you have to engage in this with a lot of courage as well, and then pay attention to what happens. And the other thing is, what I learned in graduate school: everybody Black ain't your friend, everybody white ain't gonna hurt you. But that was a hard lesson for me to learn. Not to say that racism doesn't matter, because it does. But individuals are individuals, and we gonna all get to the promised land, but we ain't gonna all get there at the same time. Some of us have a longer road to travel than others, and so you have to be careful about that. I have had several therapists across my lifespan, and some of the African American therapists were not good for me. One lady actually fell asleep on me, and it was awful.
I had someone who answered their phone during my session.
Yeah, see, that's not okay.
I was like, and I did not have the voice to be able to say, like, can you not answer your phone during my session?
Like, don't do that.
And then, okay, so when I was 19, so I didn't know anything. I didn't know anything about therapy. I wasn't in this field at all. When I was 19, I went to a therapist, and, I was just in my black power, down with the system kind of perspective. And I remember just going in there with my black thing. And she was like, well, I just don't agree with that. If I knew that now, I would have reported her ass to the licensure board.
Thank you.
But I didn't know at 19. It was so inappropriate. It was so unethical what she did. It was very hostile to me.
Now, see, that was the thing that was hostile. She could have said, I'm not quite sure I understand this, that, or other. Or she could have said, I'm wondering, is this a defense mechanism? But for her to make it personal, it's because what translated to you is like something wrong with you that you're saying this. And that's not ever okay. However, let me say that I have said in patients in therapy, mostly after we have established a relationship, I might say, what you're presenting right now, I don't think I'm going to be able to cooperate with. So maybe I don't understand what you're saying. So let's, it may be sometimes a patient is actually refusing to work in therapy, and they want to show up and just kind of say the same things over and over again. And there are some therapists who have a higher tolerance for that than I do. So I can say, so, where are we going with this? How are we working on this? And sometimes if a patient says, well, I just can't do that, or that's just wrong, or I just don't believe this, or I'm just going to always do something that may be harmful to them, I will say, it certainly is your right to craft your life. And my job, though, is to make I have an actual commitment to believing that people should stay alive. So I'm not actually going to help you harm yourself or someone else, especially if I think it's going to end in death. And I say that up front. But the other thing is, this may be something that we might not actually agree on, and we'll have to find some other things that we agree on. But as the therapist, I need to say, I'm not quite sure that I get that. But it is never okay for me as a therapist to say something is just straight up wrong with you and you can't say that again. Like, that's not helpful. That's not helpful.
So the way you say it is all like fancy and nice. That's because you got more training and seniority over me. I was like, that don't sound right, right?
Well, see, it depends on who I'm talking to.
I mean, that I only can do that. Like we gotta have like long established rapport. Like I can't say
Huh.
that off the rip to somebody,
But
but
you know what, though? What it is that I said to you, because I will let people who are listening in on a secret. Therapists are human beings too. Like we have emotions as well.
yeah.
And so when there's a patient or a client I'm really working with, that I'm engaged with, I'm involved, I'm committed, and I'm pissed. Like, I'm trying, we've done it this way, we've done it that way. So the more emotionally activated I am, the more professional sounding I'm going to be. So if I'm thinking, look, say that to me one more time, sis. But what I might say is, I don't think I can, I'm not going to cooperate with that one. Let's look at it another way. Before that time, if I'm genuinely curious, I will say, I got to tell you, that doesn't make sense to me. And I will list what they said. You said A, B, C, and then you got to G. So I'm missing something. What? But that's before. That's when I'm still curious. If I'm really irritated, I will do no harm first, always first. And so I got to stay in the process in a way that does not harm. And that's my best I can do.
Now, if I'm irritated, like I had somebody saw 4 years, and we talking about the same thing after 4 years, I said, "You're not about to sit on my couch and then say the story again. That's not what we're gonna do."
Right, we're not going to do that. I will say, and I have said way before 4 years, this is therapy. And while we actually like each other an awful lot, I really do, it actually doesn't serve my integrity to take your money so you can come and chit chat with me. We chit chat sometimes because that's a part of establishing rapport,
Mhm.
but chit chat as the primary function, nope. That's
No.
I now that is not what I agreed to do. So let's renegotiate what we're doing, and it may be that you're okay enough for now, and you might need to come back later. But I will not keep that up. I don't have that kind of time.
That actually takes us to the last question. And how do you know that therapy is working?
Lord Jesus. I love that you asked this question. I hope somebody's taking notes, because when you are asking your therapist, how do you approach therapy? You might want to ask that person, and how can you tell when it's working? But for the client, if you genuinely, first of all, feel better, we talk about that as symptom relief. But symptom relief is the stuff that's on the surface that you're having issues with. And then most
Mhm.
therapists, even if they're CBT like myself, we still understand that there are underlying processes
Mhm.
that are across a lifespan. So if you can first initially see that your symptoms are improving and not harming somebody else or yourself in the process,
Mhm.
because sometimes you want to say, oh, I don't want to be upset with my mom anymore, and so you may go back and be cussing her out every day. I feel like that might be harming somebody. That's not exactly what I would call therapy is working, unless you really need to, but that's way on the outside of things. So look and see if your symptoms are improving and that you aren't harming anyone. And then the other thing is, are you beginning to honestly see um, new things about yourself or your perceptions that also help you be more powerful and have more agency in your life? And then the third one is this therapy an actual safe place for you? Are you realizing that when you get into this therapy situation, you really can say things you wouldn't have said 5 years ago? Partially because you didn't see it, but also partially because maybe you wouldn't have been brave enough to say, but this is the real truth. So I think it is those things. Are you feeling better? Are you feeling better and not harming people? Are you learning things about yourself? And is this therapy an integral part, a safe place for that to happen?
Yeah. I like that.
I'm so glad I tried to write that down ahead of time. I wouldn't have gotten that. So thank you for asking me that question. That's a really good question, because I know we have just don't have
Mhm.
2 minutes. My struggle is always, sometimes therapy is messy and uncomfortable. Sometimes
Mhm.
you're pissed with your therapist, and that doesn't mean it's not working.
Yes.
So there is that, again, complicated relationship that you are developing with another person.
And I mean, I think that point is important to emphasize, because sometimes the way that you can tell the therapy is not working, it is working, is that you're pissed off at the therapist.
Yep. And that you go back.
Yes.
Yes. And, like,
And that you're ready to tell the therapist something. Like, I know I have been in that position where I like going to tell my therapist something. And sometimes that's what you need. You need to have the courage to be able to say something. And if it's a safe space where you can say, I'm upset at you and I am upset because of this reason, it's working.
It is working. That's good.
Dr. Shawn Garrison, she is Director of Counseling Services at Morehouse School of Medicine, and she is a good friend and colleague and elder in the tradition of Black women psychologists. So thank you.
Thank you so much for this opportunity. This was great.
Yes. Everyone, thank you for hanging out with us this week. If you like this video, do me a favor and do a like, share the video. You know, YouTube and Facebook have all kinds of interesting algorithms. And so part of what's helping me is if you share this information with other people. Also, if you want to know when I go live every week, then make sure you click the notifications buttons and it will send you a message to let you know that I go live, because apparently it doesn't necessarily, even if you follow us. Thank you. Hey, Sister Shango Yemi. This was a good conversation. I appreciated this conversation with you, Dr. Garrison.
I appreciate it too. Thank you so much.
And again, happy birthday, the day you gave birth.
Thank you so much. It was a wonderful, wonderful day.
And that's your baby, right? That's your baby.
That's my baby. Absolutely. My 30-year-old, about 5 inches taller than me, amazingly gorgeous queen of a daughter.
All right, y'all. Take care.
Okay. Bye.